Pauling, welcome, and if you'd like to introduce those with you as well.
I will. Good afternoon. My name is Kristy Pauling. Along with me is my husband, Jeremy, my daughters, Kaylee, Cassie, and Caitlin. We are here today on behalf of Caitlin. She is 7. She suffers from Batten's disease and intractable epilepsy. Batten's disease is a neurological disease that is caused by genes being odd-shaped and kills off brain cells, and with every seizure, it kills more of her brain cells. She is on 10 prescription drugs, which are in front of me, that have worse side effects than medical cannabis, and they are FDA approved. A few side effects of the medication she is on are liver damage, kidney damage, loss of eyesight. About an hour ago, I gave her Diastat, her emergency medicine, which is Valium, 20 milligrams to help stop some of the movements. It has done nothing. She'll do this for hours on end. And it's not something that anybody likes to watch. But this is our daily routine. We have no other legal, we feel that medical cannabis would be a much safer option for her. We have no other legal choice right now but to give these medications that are horrible for her. She started out as a healthy child, and when she was 3, she started having seizures. We were told by many specialists she would outgrow it. As the seizures got worse, we sought out other specialists. When she was 5, we finally got the diagnosis of Batten's disease. Not something a parent wants to hear. She has a life expectancy of 10 to 12 years of age. Since diagnosis, she has regressed back to an 18-month-old. She cannot eat except through her G-tube. She cannot walk, she cannot talk, and is wheelchair-bound. We have no way of knowing if she is in pain, she can't tell us, and she constantly has seizures. We are hoping that with the legalization of medical cannabis, it will help with the seizures and maybe get to hear the words Mom and Dad again. She has not said since 4 years old. We also hope for a few more years with her. You would think the hardest thing was the diagnosis, but it's telling her 2 older siblings that her sister is going to die. We have looked for remedies and procedures. Nothing has worked. Then we heard about Charlotte's Web in Colorado. We are torn between uprooting our family and moving to Colorado away from our family and the state we love, or staying here and see what happens. We need this law change now for safe legal access in the state of Minnesota. I'm a registered nurse with a Minnesota state nursing license. My husband is a business owner. If we choose to do the illegal route, I run the possibility of losing my nursing license, going to jail, or the most important thing to me, losing my beautiful daughters. What kind of parents are we if we break the law? What kind of parents are we if we don't do everything we can for a terminally ill child? We have decided that if Minnesota does not pass the bill legalizing medical cannabis, we will go to Colorado and leave the state that let me down and so many others. This would require uprooting everyone and take my daughters away from grandparents, aunts, uncles, cousins, and the family values I thought Minnesota offered. When there is treatment that is working for lots of kids in other states, Minnesota needs to be open-minded and give my child and other families a chance at a better quality of life for their loved ones. Thank you for letting me share my testimony today.
Thank you, Ms. Pauling. Mr. Pauling, would you like to say anything?
No, I'm good.
All right.
He's kind of outnumbered.
All right, any questions by members of the committee? Well, Senator Newman.
Thank you, Mr.
You
Chairman.
have a question, Ms. Pauling. Hold on.
Ms. Paulus, and the form of the marijuana that you provide to your daughter, what is it and how is it administered?
Ms. Pauling.
We have not administered any form of it. It is, like I said, it's illegal here. I can't do this by myself, and if we split our family and half of us go, I can't do it.
The form we would be using would be the Charlotte's Web. The oil form is the main form that we'd be using with our daughter.
Sure, thank you.
Yep.
That's the information I was looking for.
Okay.
Thank you.
All right, Chris.